My name is Constantine Demetracopoulos, and I'm an orthopedic surgeon here at the Hospital for Special Surgery. I specialize in foot and ankle surgery. We treat anything really from the ankle down to the foot. That can be any sports type injury, any arthritis or degenerative condition, or any deformity of the foot or ankle, whether it's a flat foot or a high arched foot. Oftentimes patients come with pain, right? And so it's then my job to determine the source of the pain. And oftentimes they believe they know what the source is, or they've been told what the source is, but really the majority of that first visit is identifying what the true cause of their pain is. And then it goes to the physical exam, which I think is very important in the foot and ankle, not only trying to identify where the pain is, but also looking at their alignment, how they walk, how they stand. And then it goes to x-rays, right? So we use x-rays a lot. I have x-rays on every patient that I see as a first-time visit. And then if necessary, we go down to more advanced imaging, like whether it's a CT scan or an MRI. And I think it's important to really go through that whole process before really implementing any treatment plan. Well, I think most people would prefer non-operative management, and I think that makes sense if it's effective. So first I determine whether they've maximized their non-operative treatment. And if they haven't, then we'll go down that route. If they have, that's when we begin the discussion of surgery. And it's my job to really explain to them what surgery is, what it entails, and what the post-operative recovery is like. And it's really to set this up as in a framework of realistic expectations so that they know what to expect from having surgery. And then once they have a good understanding, they can determine whether surgery makes sense for them. You know, I became interested in foot and ankle surgery in residency. Of all the specialties, I found that it had the most variety of not only of different conditions to treat, but also had the widest range of patients. I can have a 14-year-old patient, and then the very next patient could be 85, and they have very different problems, and I can offer them very different solutions, but get them to the same goal, which is, you know, to alleviate their pain and allow them to return to the activities they love doing. I mean, that's the reason we do our job. I mean, it's very rewarding. It makes all of the sacrifices and the hours worthwhile. And I think that's one of the advantages of orthopedic surgeries, that we're able to take patients and return them to a certain quality of life or a certain function and truly make them better.